Would you like me to keep my video on or off?
That's up to you, Ed, whatever you're comfortable with. So we're now recording. It's my pleasure to introduce Dr. Neuhaus with the American Board of Clinical Psychology to present on board certification in clinical psychology.
Thanks, Leo. Hi, everyone. Welcome to our presentation. I'll leave on my video just with these introductory comments, and then I'll turn it off once we get the slideshow. So I'm happy to be here. I am the education director for the Board of Clinical Psychology, a board member as well for some years, and I've been affiliated with McLean Hospital, Harvard Medical School for many years. Formerly co-director of psychology training and the internship until about 2009. And so I look forward to answering questions. I'll keep this succinct, and in a sense, it's really to kind of direct you to the right information for you to, help you decide around pursuing board certification in clinical psychology. So without further ado, let me just make sure. Okay. Okay. All right, so why don't we just get started? Come on. There we go. So the why, the board certification, I will review the general high level reasons of why clinical psychology and board certification, eligibility criteria, the application process, the evaluation criteria that drills down into competency domains, and then I'll get into more details around kind of the mechanics of what a practice sample is, a professional statement, and essentially how you weave together your narrative as a professional psychologist. There is a senior psychologist, meaning that you've had a number of years already in the field, so that can get you into play without having to submit certain elements of the application. It's a little more streamlined. And then I'll give you some screenshots and like actually accessing the website. All right, so the objectives here, as I said, we're going to drill down into the, the core competencies, the foundational and functional, and then the application process. So, so why board certification? That is a question you're asked in your application and asked to discuss in your oral exam. And at the highest level, it's really a demonstration and formal recognition that you've attained a specialty level in clinical psychology. And for some, it may improve your position for promotion or salary increase, but not guaranteed. But that certainly may be important for where you work. If someone could, everybody make sure you're muted. Thank you, appreciate that. So, and then other elements of board certification, just a demonstration of your interest of in lifelong learning and professional development. And in some cases, it might help with moving from state to state or a credentialing process. Again, not guaranteed, but in some states that very well may be the case. So the definition of clinical psychology, the intent here is not to teach you what clinical psychology is, because I think everybody should know that. It's more drawing your attention to understanding, well, what are the differences of the specialty areas within the American Board of Professional Psychology. So clinical psychology versus health psychology, or behavioral and cognitive, or neuropsychology, for example. So that is really the key thing to say. If you want to, if I want to pursue this board certification, let me make sure it fits with my professional area of expertise, interests, and so on. So make note in that you know, you do not, and I just want to say that there are elements here that are kind of foreshadowing that you don't have to be, you know, in a private practice, you know, to pursue this, that there is a wide range of things that you can provide: direct service, supervisory service, you know, academic research, administration, but it does all weave together into, you know, a narrative of you as a clinical psychologist. So the basic eligibility requirements: doctoral degree, internship, and then postdoctoral experience. And depending on whether you do an actual postdoctoral fellowship versus its postdoctoral experience and supervision that you have, it's, you know, a little bit different in terms of the number of years, the 2 years experience, you know, working in a manner if you're not doing a you know, the formal postdoc, and then it's different when you do the postdoctoral training. And then of course you have to be licensed, you know, independently licensed within, you know, your state or provincial board. So here's the big picture roadmap of the application candidacy process. So you think of this top level: you submit an application, then there's a review of the practice sample, and then there's an oral exam as the final step. So, you know, the submitting the application is you going to the website, you have to submit your, you know, you submit your practice sample, the fees, and that at that point, there is a screening process that someone in the board, the Board of Clinical Psychology, will review the application to make sure that all the eligibility requirements are met. And once that is determined, yes, it's a go, then an exam committee is convened, and there is the practice sample. And that is a combination, you know, you have your CV and the professional statement, video samples of actual interventions, supervisory processes, or, you know, the senior option, which I'll get into a little more detail, that you don't have to submit a video, but you have to present a portfolio of work. And then there is the nitty gritty of evaluating you as a candidate is based on the criteria for core competencies. And that the general pass of that is two of three examiners in all domains. And then once you get through, this is, you know, it's the paper or the digital, you know, the digital document submission. Once that is established, then you go through the next gate, so to speak. The oral exam is scheduled, pay your fees, and then you have the oral exam. It's typically 3 hours, maybe a little bit more. You know, when all is said and done, it's intended to be a collegial conversation. Everyone, you know, the committee members know you as a candidate based on, you know, the comprehensive documentation you have presented about yourself, your professional work, and that over the course of the exam, we'll review aspects of your CV. It could be the arc. It could include, but you know, there was some variation of the arc of your career, examples of that, decisions of why you chose one path versus another, and then really drill down into the, you know, into your core competencies of you know, evidence-based treatment, your relationships, professional relationships, ethical elements, and then, you know, things like intervention and consultation that we'll get to in a minute. Then to be approved and confirmed, you have to pass all domains by 2 of 3 examiners. So it does not have to be unanimous, but, you know, 2 of 3 in all domains. So you have to meet the standard across the board. All right, let's go down into more specifics. So these next slides have a lot of information on them. I'm not going to read them. I'll give you highlights. I have kind of different ways you can see that there are behavioral anchors, that how do you operationalize this, and how are you evaluated? So that really is probably the most important thing to be paying attention to here. So if you look at, there's foundational and functional areas, but there's functional and then the optional functional, which you'll see. So first are, relationships, individual cultural diversity, the ethical area, your professionalism, and so forth, evidence-based practice and science and knowledge. And then the functional areas: assessment, diagnosis, conceptualization, intervention, and consultation. If you look at this here, you can see me circling this. These are the necessary requirements. Everyone has to do this. The additional areas, and this is where people sometimes have questions like, well, do I have to do this or that? You do not have to do the optional functional areas. However, if you do include them in your application, you have to demonstrate, your competency in that, in how you present it. And it may be some combination of your CV and something in your professional statement, and you give examples of it, of how you practice in these functional areas. So let's go kind of drilling down. So relationships, how do you work together with people, from diverse views, different contexts? Could be conflict negotiation, communication, your approach as a professional, maybe as a leader. If you're, let's say you're a clinical director or principal investigator, like how do you work with your colleagues and develop relationships? And then, individual cultural diversity. So this is really showing an awareness of the major issues according to APA guidelines. APA does have very robust section area of that you get the information, and then how your own characteristics of diversity and what their influence are in your practice, in giving an example. And I will say in any of these areas, when you can give an example that reflects who you are, how you make decisions, how you approach something, that has, if you think of writing a novel, like there's got to be a beginning and a middle and an end. Like there's got to be a plot, and is there some resolution to it? So, if you're giving an example of an issue around whether it's diversity or let's say it's ethics, present what it is, what is the ending, and then how you got there. I would say one of the biggest areas that I've seen in applicants who have not, passed, is there's kind of a lacking of how do you get from point A to point B to point C and coming to a resolution in your decision making or whatever that might be. So the ethical and legal standards, again, as I just said, professionalism, again, showing accountability, giving examples, anecdotes are important here, but not just kind of general, be specific. Reflective practice and self-care, self-assessment. I will say that this is something a number of years ago that became a very important piece of the internship training, like at where I was at McLean Hospital, and we had, it was orientation, and we had a kind of more of a formal structure of checking in with people around their self-care, because when you're in internship and maybe you're writing a dissertation and you're not getting paid all that much and all those things, I mean, those are things where you can kind of lose sight of what is going on. And oftentimes, those earlier ways of how people have taken care of themselves or not, come into play. So this is a time to reflect on what do you do? And, even if it's something like, wow, I haven't done so well in this area, but now I've noticed it again, what is the story? How are you telling your story of who you are as a professional? And then, interdisciplinary, many people work in hospitals, institutions with, different disciplines. How do you get along with them? examples, then the science and the evidence-based practice. Those two things are somewhat part and parcel of one another, but they are separate sections. And as you can see, there are a little bit different angles to those. But ultimately, it's your rigorous thinking, your scientific method, trial and error, problem solving, and to be able to explicate that. And then the assessment, diagnosis, intervention, and consultation. I will say that the consultation element can be ambiguous. It's not being a supervisor. It can include supervision, but is you as a consultant. How do you consult with peers, with maybe other departments, other disciplines? Be specific. And then the optional areas: research, supervision, teaching, management, and administration, and advocacy. Whether, if you do bring it up, it opens the gate to say, okay, you're going to be evaluated on that. And if you really are, if you present it and you don't present it clearly or well, that says, okay, well, why did you bring that up? So we want to just make sure you don't have to bring these up, but when you do, have the complete story. Okay, so the practice sample. My teenagers tell me I repeat myself, and I'm guilty as charged. So I'm going to say, create a narrative. Here it's weaving the competencies into a narrative. And so you have the competencies, and you'll see, when you go to the manual, form F, and things are outlined in a table and boxes and everything. But the actual application is not that way, right? So the idea is there are different sections of describing your professional work and how you utilize scientific knowledge, evidence-based practice, and again, you're telling the story of who you are. The videos, these are a little cumbersome to do. You've got to set it up, you got to get permission, but there are very clear guidelines in the manual. A few key things, done within 6 months of submitting. And also, as we found, just make sure there are no identifiers. There's PHI here that we want to protect, certainly patients, clients, from any identifying information, your own ID badge, those kinds of things. If you have to, turn it over or whatever that is, and go through, you have to just make sure you follow the directions. So the senior psychologist option is 15 years post-license. If you just use that as the time, and then you kind of work your way back, okay, you've got to meet all the requirements, your CV, professional statement, but instead of a video, you can present a portfolio of work. That may include publications, peer review article, book chapters, as well as presentations. Maybe you're out on the presentation circuit, or in-house you have an area of expertise that you have done a body of work, so that is what you would include in lieu of a video or the 2 videos. And so let's go back. So you submit the application, get the clearance, you've met the criteria, do the practice sample. That's the written part that is evaluated. Once you pass all of that, exam is scheduled, and then everything is reviewed in really a collegial atmosphere. So a couple helpful hints: follow the instructions. Just from a kind of cognitive or even like neuroscience standpoint, like your brain, you can be stressed and you've got all these checklists and what do I do? Just slow down, make sure you've got things organized. We have put checklists into the manual to help you, and just to be able to go through this and this, because there's a lot of information. So slow down, stay focused. The professional statement, that's your story. Patient information, make sure that's all gone, but timely videos. And just one thing about the ethical dilemma, this is not just a high level ethical general situation. It is what happened, what did you do, what other people perhaps did, what was the resolution, and to be able to connect the dots A to B to C on that. Like, how did that happen? And as I just to mention the consultation part, make sure you've got a sense of consultation and convey that you are doing consultation as opposed to it's just general supervision or something informal. And if you need, you can always ask for a mentor through ABCP. And that's something that I will not go into detail, but suffice it, you feel like, okay, I need a little more help, or I need some more information or some guidance, you can contact ABCP and have a mentor assigned to work with you. And now the websites and screenshots. So here is our analog circling of on the screen here about submitting a new application through so it goes through the American Board of Professional Psychology. I will say that just as a little coming attractions, that we will have our own website, the Academy of the American Board of Clinical Psychology, that we will be having additional information and resources for you. But for the way it is now, everything goes through the ABAP website. So you go to ABAP, you submit a new application, you look at the specialty requirements here, you choose clinical, go through clinical. There are documents that give you supporting the application, supporting materials, and so on. And as I say, here's the document library. And I think that was maybe 21 minutes, but I think we're close. So questions?
We can start with a question that was entered through the chat. The question was regarding psychologists that have PhDs in counseling psychology, and if the doctoral degree needs to be in clinical to apply. I can answer that if you'd like to.
Sure, why don't you?
Okay. So the quick answer is no. You don't have to have your doctoral degree in clinical psychology. If you have a doctoral degree in counseling or counseling combined with school, then it changes the postdoctoral requirement. So the requirement then becomes 3 years of postdoctoral experience, where at least one of those years is supervised, which essentially is 1 hour of supervision over the course of 12 months. And that the psychologist practicing in domains or with that are typical for clinical psychology and identifies as a clinical psychologist. So the short answer is no. We are in the process of kind of revising and refining that information, but as it stands, it's 3 years postdoctoral with 1 year of supervised practice. So let me know if I answer that question sufficiently.
I think you did. The 1 year of supervised practice has to be part of that postdoctoral. The internship cannot count toward that, correct?
Correct. So it's 3 years total postdoctoral with 1 year of supervised practice within the 3 years.
Thanks.
You're welcome.
Can you guys talk a little bit about how folks have managed to get approval for submitting video work samples through the VA? I know VAs can vary location to location. Is it just kind of working it out locally, or do you have any words of wisdom about that? I think it's very intimidating, and I'm trying to encourage a lot of my staff to consider board certification, but I think they're very intimidated by having to go through the VA processes to get permission to video. Not so much just the recording, but like actually, getting it out of the VA, obviously appropriately, but it's a little daunting.
Yeah, I have a few thoughts. Ed, go ahead.
No, I was going to defer to you because that is not my area of expertise in the VA.
So it can be challenging. So there are going to be facility level differences. The most successful path that I usually have heard is the path that I use because I went through the process when I was at a VA, is that I first reached out to the privacy officer to kind of describe the process and give them information, usually with the support of my leadership. So chief of psychology, program manager, something like that. Letting them know that it'll be completely voluntary on the patient side, and the recording is for essentially educational purposes and credentialing purposes. So usually that answers the question for privacy officers. Not always. Sometimes it does have to go to a VISN level kind of review. But at the facility level, then the next step I went through is to ensure I had the appropriate approved equipment to record. I actually went to our medical media department to ensure that I could use equipment that then recorded to a USB drive that was approved by medical media. You have to get all the correct forms, which I'm probably out of date on the number of what those forms are called, but essentially approval from the patient to be video recorded, and then the consent for the release of information. And ABAP includes in the exam manual for the clinical board and all the boards actually, there's a sample consent that can be used with the patient. I think I vaguely answered that because there are going to be facility level differences. Is there anything I can clarify?
So then what did you do with that USB drive? Did you send that in, or did you upload it to the ABAP website off of a computer, or?
Yeah, so at the time and currently, but perhaps not in the near future, the clinical board was using USB drives. So then I took those USB drives that medical media said these are okay to use, and then I sent them via U.S. Postal Service to the regional director with clinical psychology. So you send the USB drives. When we shift, hopefully in the near future, to a cloud-based storage where we could upload, the question will be that if VA firewalls will allow that. We are working with VA Central Office to try to make sure that the systems are compatible. But as you probably know, IT is really complicated. So we're hoping that it's going to work out. But if not, we will have to find a workaround specifically for uploading for VA psychologists. Did I answer that? Okay. We got another chat question. So could you please speak to what factors we should consider if we would be eligible to apply for board certification in clinical versus health psych? So pros and cons of pursuing either.
Yeah, I think some of it is, what is your professional identity? Like, how do you define yourself? There was just giving you an example that, I've done a lot around in the CBT world, and, running programs in that, and research. And that was a question I remember on my exam. They're like, well, why didn't you do the CBT? And I said, well, I'm really looking at this more as a generalist. I do teaching and training and research, and yes, CBT is one thing, but my view for board certification is more, I'm viewing it, my own identity, more broadly in all areas of what I do as a clinical psychologist. So in a sense, clinical psychology, clinical is more broadly defined. I mean, it's neither good nor bad. I mean, you got to decide, versus more of a specialty area of health psychology. That's my take on it. Leo?
Yeah, my thinking, usually the discussion I have with people kind of considering multiple boards, something like clinical health versus clinical psychology, is that one is that professional identity. So how do you really think of yourself? How do you want your colleagues, your patients to think of you? And that's currently and in the future. And then the other piece of it is, what are you doing? So there are clinical psychologists doing health. There are health psychologists doing clinical. And you want to consider it when you're submitting something like practice samples, what is capturing your professional identity and your day-to-day practice. So if you look at another specialty board and you think, well, that's more of what I do and more how I identify, that's probably the one you want to go with, right? If you are in a 50-50 kind of situation, you probably want to go with one that has, in your opinion, the greatest maybe future career potential, or how you want to be identified for the longest period of time. At the same time, there are definitely specialists that are board certified in multiple areas. Clinical psychology and clinical health is a fairly common one. And it's usually because someone started in one and then developed another, or was very specialized and wanted to be identified more as a generalist. The careers those career changes can occur. In terms of pros and cons, probably all those things that we talked about. But I, in making my decision, I wanted the longer term identity of clinical psychology. I thought, well, most of the time, and probably likely in the future, that's what I'm going to identify most consistently as. But I recognize that could change, and you can get multiple board certifications. Let us know if we answered that enough for you. Okay, yeah. Any other questions? Right. I don't see any in the chat, and I'm not hearing any. So that might be it. Feel free to email me. I put it in the chat, my email address if you'd like a copy of the slides. And if there's no other questions or comments, I just want to thank Dr. Neuhaus for presenting today. I really appreciate that.
Happy to do it, and certainly reach out, well, through Leo if you have a question to me as well. Thanks, everybody.
All right, thank you.